get us started off here. This is a graph of, in 2017, how many knee and hip replacements were performed in the US in the year 2017. So we're looking at almost 1 million knee replacements that are being performed on a yearly basis. And the numbers are actually increasing. They might be a little bit down in 2020 because elective surgeries were kind of delayed because of COVID. However, this trend is on the rise. Hip replacements is also very prevalent, but not quite as much. So we're going to talk about, the good news is the surgery and the technology has come a really long way. And in a lot of ways, knee and hip replacements are a wonderful invention that we've been able to create in the world of science and medicine. However, they're not perfect for everyone. And if we can avoid surgeries, or if we could do things proactively to avoid ever having to do that, that's what we're here to talk about today. All right, so we're going to talk about that nagging knee pain. So I thought this was just kind of a funny thing to get us started. It says knee joint replacement unit. This is a rush case. Coach needs them in back for the fourth quarter, right? So I kind of say this jokingly, but it does seem like it's a nice, easy fix. And a lot of people want to run to, all right, well, my knee hurts, go ahead and do surgery, get it done, and let's move on. And sometimes it's not that simple. So we'll talk about that. Another little fun meme here. Remember when you could refer to your knees as right and left instead of good and bad, right? So who here has a knee that now they say that's my good knee or that's my bad knee because they've either had it replaced or that's the one that's bothering? Maybe you guys are saying that both knees are bad. Either way, that doesn't have to be the norm. So what are we going to talk about today? We're going to talk about some of the alarming stats behind knee pain. We already talked about how knee surgeries, replacement surgeries are on the rise. We're going to talk about why so many people have knee pain and what you can do to prevent it. We're going to talk about the 7 most common myths about knee pain, including the 1 or 2 things that people do to actually make their pain worse. We're going to talk about how arthritis is not always the cause of pain. Some people always want to assume that. We're going to talk about why injections and sometimes surgery is only a temporary solution at best. We're also going to talk about common treatment options for knee pain, as well as how you can receive a free discovery session from our experts here at Natural Fit Therapy at no cost to you. But ultimately, we're going to learn about how you can live a healthy, active, independent lifestyle without annoying and sometimes crippling knee pain. We realize that nowadays people want to have a active, fulfilled retirement, right? We hear so much about people saving money and living this new retirement, right? So retirement used to just mean I'm not working anymore and I just kind of sit around and waste away, right? We didn't live this long 50, 60 years ago. And now we want to live our retirement, right? Retirement, the baby boomers have completely redefined what retirement is supposed to be. And most of us want to retire to be able to travel. We want to play tennis. We want to play golf. We want to be able to do the hobbies and things that our younger selves enjoy. However, what we find is a lot of times people spend so much time getting financially ready for retirement that when we actually get to retirement, our bodies are not able to do all the things that we wanted to do. So that's what we're all about here at Natural Fit Therapy, and that's what we want to be able to help you guys with. So who am I and why should you even listen to me? First of all, like I said, my name is Ryan Seifert. I'm a doctor of physical therapy. Picture on the left here is my family. That's my beautiful wife, Laura. She is also a doctor of physical therapy. We met as study partners in physical therapy school and hit it off ever since. You can see my older son is 5-year-old Nathan. And then that picture's a little dated from last Christmas, but Caleb has gotten a lot bigger. He's a 2-year-old now, and they keep me busy, and they're my why. why do I want to stay healthy and active? And why do I want to make sure that I'm able to, when they have kids and they're planning family trips and they're going to want to go hiking and travel the world and they want to invite me as grandpa along, I want to make sure my body's ready for that. And so that's why we're going to talk about specifically knee pain today. That's Caleb on a boat ride last summer. That was his first boat ride. So a little more about me. I started natural fit therapy because I wanted to, I worked for a big corporate clinic that I learned all these great skills to be able to help people. Manual therapy, specific exercises, all these different modalities, that treatment options that I could do to actually help people. And I worked for a busy corporate clinic, like most of the clinics around, and I was seeing 3-4 patients an hour. And I was running around with my head cut off, trying to give everyone equal attention. And I realized I wasn't really helping anyone, or at least not as much as I could. So I went ahead and just because I was almost ready to give up on my profession, because I feel like there was just no way I could help people in this environment, I said, I'm going to start natural fit therapy and I'm going to do things differently, right? So since then, now I'm going on 11 years as a physical therapist. I've wrote several helpful tip booklets. I've been featured in the Austin American-Statesman in our health column on a regular basis. We also put out a natural fit therapy newsletter that goes out to over 500 people in the Austin area. I've been invited to give talks to large groups of over 200 people, as well as small groups like you see on the right. And something that's cool, since COVID, one of the things that came out of it is we started doing a lot of things virtually. So you're able to learn more about what you can do to stay healthy and active right at home. So here's a couple pictures of our past workshops. And we had been having a blast and have been continuing to do those since March 2020. Oh, it looks like Sharon finally made it in. We'll go ahead and let her in. Make sure she gets connected all right. Sorry for the interruption, guys. All right, I'm just going to keep going while she tries to log on there. All right, so here at Natural Fit Therapy, we help you stay healthy, active, without surgery or pain pills, so you can fully enjoy the retirement that you've worked so hard for. So we talked about that, but that's what we stand for at Natural Fit Therapy. So who is this workshop for? This workshop is for someone who their knees hurt when they walk or stand for long periods of time. People who avoid getting down on the floor to play with grandchildren because you're worried about the pain, or you're worried if you're going to be able to stand up afterwards. It's for someone that they're just worried their knee pain is going to get worse, and maybe they'll need surgery down the line if they don't do something about it. It's for someone that avoids stairs because you're fear that your knees will give out on you, or that you're just going to pay for it the next morning. Someone who their doctor told them that there's nothing they can be done because you have arthritis. You have bone on bone and there's no cure for arthritis. So you just have to live with it unless you do a knee replacement. So we're going to talk, that's who it's for. But ultimately, it's for someone that doesn't want to sit back and let old age and knee pain take over their life. They want to be proactive and learn what they can do to improve their knee pain and what they can do to keep it from coming back. Right? So is everyone in the right place? We're here to learn about knee pain. All right. So we're still with me? You guys are all hearing? Good. So let's talk about knee pain stats. So 100 million Americans suffer from chronic knee pain. So that's from the CDC. And knee pain is the second most common cause of chronic pain. Number one, can anyone guess? Back pain. So we talk a lot about back pain here at Natural Fit Therapy. So if you have back pain, that's something else that check out one of our webinars or workshops on back pain. But knee pain is the second most common source of chronic pain in Americans. 1/3 of all Americans report experiencing knee pain at some time or another. Oftentimes, knee pain is the result of too much weight on the knee joint. There's a lot of correlation studies that show increased BMI leads to a higher incidence of having knee pain or reporting knee pain. And another leading cause of knee pain is improper technique during activity. And that's one that we want to talk about today, because that's something that we can control. Obviously, we can control our weight, we can manage our weight, decrease our BMI, but between those two, we have a lot of control. Yes, there's a little bit of genetic component. Yes, there's some things that are out of our control, but if we live a healthy lifestyle with regular exercise, with proper form, our knees are meant to move. Our knees are meant to be active, and we do not have to slow down into retirement if we do things right. So, as I said, knee replacements are on the rise. One thing is, I think, just it's a common problem, right? And so if more people are complaining of knee pain, surgeons have a quote unquote solution, obviously more people are going to seek that out. But we work with several people here at Natural Fit Therapy that are still having knee pain after a knee replacement. And we're still having to work with them to be able to get them strong enough to be able to get back to the activities that they want to do. So why not address it before we have to have knee replacement? The other thing I want to point out is you may already be thinking, you know what, my doctor said I have knee replacement, I have bone on bone, there's nothing I can do, I'm going to have knee surgery, it's just a matter of time. Maybe it's 6 months, maybe it's a year, I'm waiting to get in. Maybe you've already scheduled your knee replacement. Either way, the research is very clear that if the stronger you are, the better knee mechanics and form you have, and the more range of motion, the more your knee can bend, the better your outcomes will be after surgery. So we get so many people say, why would I waste my time coming and working on those things when I'm just going to get this knee replacement? People think they're going to wake up the next day and things are going to be all better, right? The thing that they don't realize is that over time you start getting fibrosis in that joint, and it starts getting tighter and it starts getting stiffer, right? That doesn't just go away when they replace the joint surface. Yes, the joint surface is now metal and isn't so-called producing the pain, but you still have ligaments, you still have muscles, you still have the joint capsule around that. If we don't do something about it before surgery, it's going to be a lot harder to get you where you want to be after surgery. So regardless of if you end up having to have a knee replacement or not, this is what it takes to live a life without knee pain, is to do the things that we're going to talk about today. So impact of knee pain. So first of all, what happens, most of the time people have knee pain fairly early on. People in their 40s and 50s are first starting to have some knee pain. And what happens is they just slowly start reducing their mobility and their activity, right? So you just kind of, well, you know what, running's not a good idea anymore, so I'm not going to run. Or I'm going to stick to swimming, or I'm just going to do golf, or I'm just going to do something that's low impact. And so what happens is people end up slowly reducing what they do, and they stop activities, they stop hiking, maybe they stop golfing, or they just use a cart when they go for the 18 holes. They stop dancing, they stop doing the higher level stuff. And then it gets to the point where now you're weaker, you're more deconditioned, your joints are stiffer, your pain now increases, and now you have a second thoughts about participating in social events with friends and family, right? Do you want to live a retirement where friends and family say, let's go ahead and go on this nice trip to the Grand Canyon, we'll do some hiking, and you say, uh-oh, I'm not sure I want to sign up for that because I don't know if my knees are going to make it, right? Maybe I'll have to stay at the lodge by myself, right? And so what happens is people's worlds start shrinking. They stop going on road trips. We stop traveling and going on airplane rides. We stop playing with our children or grandchildren. Maybe we think twice about going shopping, and we spend more time sitting or lying in bed and less time living life, right? So also, pain leads to immobility, which leads to joint stiffness, which leads to more pain. So this is a snowball effect, right? We have to find a way that we can stop this cycle. Otherwise, our world shrinks, we do less activity, our pain gets worse, and our quality of life goes down, right? So For example, I was just working with a gentleman about 3 months ago. His name was John, and he was really into golf, right? So he first started to have pain when he was about in his 40s, and he had great plans of traveling the world with his wife. They wanted to do this European tour, and then they wanted to go travel around Asia. They had all these plans. He used to golf occasionally on the weekends, and he was so looking forward to when he retired that he would be able to do all these things. Well, at first he started having knee pain, so he thought, well, I'm just going to stop going to the gym because I think it's the treadmill and I think it's the elliptical that's bothering it. So he just stopped going to the gym completely. He continued to golf, but then it got to the point where he ended up retiring. They moved into Sun City, Georgetown, and I mean, if anyone knows anything about Sun City, there's so many things to do. There's so many activities. There's, I think, 2 golf courses. They have hiking clubs and pickleball and tennis and all kinds of activities. And he was like, you know what? I'm ready to go. This is the retirement that I've been waiting for. And sure enough, he was playing pickleball for the 3rd time, and his knees were just killing him, right? He was doing 3 times as much activity as he was used to, and his knees now were really bothering him, right? And so he ended up having to cancel a couple trips, and then he ended up finally coming in to see us, and he's like, I wish I would have done something sooner, right? So again, how do we keep this snowball from getting too big? So now I'm going to talk about the 7 most common myths, because first off, I can go ahead and tell you what you should do, but a lot of people have other opinions, right? They've heard from their doctor, they've heard from friends or family, they've heard from other people, other advice. And I want to make sure we kind of get rid of the myths or the kind of misconceptions around knee pain before we go into the actual treatment of what we find works best. Uh-oh, why did my thing stop moving forward? There we go. All right, so 7 most common myths. So number 1 is arthritis is always the blame, okay? So the cause of persistent knee pain is always the same, and arthritis is always to blame, right? Now, obviously you can say that's probably not true. Yes, I've heard of ACL injuries and I've heard of meniscus injuries, but majority of people, when they get to age 50 plus, their doctor says you have arthritis, and that's the blame for knee pain, right? Well, the interesting thing about this is that arthritis is something that can be managed, okay? So minor to moderate arthritis actually has poor correlation to pain levels, right? So they did research, and what they did is they actually took radiographics, so x-rays of people's knees, and they measured how much arthritis, right? You can see the increased white spots in between the 2 joint surfaces, which is indicative of osteoarthritis. So we're talking about, when I say arthritis, I'm talking about osteoarthritis. I'm not talking about rheumatoid arthritis or giant cell arthritis or anything like that. We're talking about osteoarthritis. So it's most common, most typical. Minor to moderate arthritis has a poor correlation to pain, okay? So a lot of people with very little pain or no pain at all, if you x-ray their knees, can show moderate arthritis. So a lot of people assume that, well, if arthritis shows up on an x-ray, I need to have a knee replacement. However, there's lots of people that are living with arthritis that don't have pain or have very little pain. So that's our first clue that there's something else. It's not just arthritis, right? So we run across this all the time where we have people that were told by their doctor that they need a knee replacement because they have bone-on-bone arthritis, right? This is not true. He really didn't want to go through surgery, so they ended up coming to us, and he was able to get back to golfing and doing the things that he wanted to do without having his knee replaced. So motion is lotion. The research shows that with proper form, regular activity, not intense activity, but moderate activity actually decreases pain when it comes to arthritis, right? So the hard part is it ends up kind of hurting to get going, but once you get going, it starts to loosen up. Motion is lotion, right? And so finding ways to reduce the stress on your knee and keep the wear and tear from accelerating, but you gotta keep moving. And a lot of people feel like pain is danger and I need to stop doing whatever I'm doing. If you have moderate to severe arthritis, there's some people that we tell them we're not gonna get rid of your knee pain. But if we can keep it at a 2 or a 3 out of 10, and you can still do all the things that you wanna be able to do, well, then that's better than it sitting at a 7 or 8 and you contemplating doing knee replacement. So there's lots of other structures that can be the culprit. You can have meniscus injuries, you can have ligaments, you can have tendons, you can actually have the muscles themselves be sources of pain. You can even, I had a gentleman just the other week that came into our clinic saying that he had the worst knee pain and his doctors say they don't know what to do because his knee doesn't have any arthritis, and the MRI came up completely clear. After we did an evaluation, we found out that it was actually his back that was causing the pain, and he had nerve referral pain in his knee, right? So it's not always cut and dry. Some doctors can wean that out and they'll send you to the right place. But some primary care doctors and even some orthopedic doctors, they're just too much in a hurry. They don't get enough time with you to be able to actually evaluate you, to get an accurate diagnosis. So myth number 2 is pain pills, right? Oops, I don't know why this went in a different order. There we go. When I have knee pain, the best way to deal with it is to power through it, grab a handful of pain pills that allows me to keep going, right? So first off, anti-inflammatories. So we're talking Advil or naproxen or ibuprofen. It's okay to take those. There are side effects, and if you take them on high doses for a regular basis, you can have issues with your stomach, with bleeding, with ulcers. But the research does show that can reduce inflammation associated with arthritis, and in conjunction with physical therapy can actually get you over that hump of being able to exercise again. This is for people that have really flared up knees, and it can actually help. Now, pain pills, we're talking opioids, narcotics, hydrocodone, oxycodone, morphine, Vicodin. These have actually showed to have much more serious long-term effects, and they can be possible addiction and dependence, and actually long-term studies show an increased report of pain. So what happens is pain is your body's alarm system, okay? Think about if you were home alone and you had someone that was trying to break into your house, right? And you knew the neighbors were home. And so what you were gonna do is you're gonna go ahead and try to yell to the neighbors to call the police, right? So there's a threat outside, or your body feels like there's a threat, and you're gonna yell, right? You're gonna say, hey, someone help me, right? Well, taking a pain pill is just decreasing that alarm system, right? So what happens is, it'd be like if someone came and put a blanket over your head so that when you go to yell, it's just kind of muffled, right? You don't hear it as much, right? But the threat is still there. So what are you gonna do? You're gonna yell louder, right? I need to yell louder to get my alarm message out. So what your body does is actually sends more pain signals to the area because of it being dampened down by the pain medication. So then when you stop taking the pain medication, you actually have more pain. Or what happens is people need higher doses, and then they end up getting dependent or addicted. So if you're currently already taking narcotic pain medication, just don't stop tomorrow, because that's a bad idea, but work on a plan of how we can go ahead and get you off it. I had a gentleman named Bob, I won't say his last name, but his was specifically for back pain, but he was taking hydrocodone 4 times a day, just because that's what his doctor prescribed him. We started working with him, did a lot of the same things we would do for knee pain, just specific to the back. And he was able to reduce to 2 times a day and then down to 1 time a day. And then when we stopped working with him, he was only taking it occasionally at night. So there is stories of people that can get off of pain medication. So don't think that's your only option. So number 3, injections and surgery are your only options, right? So injections, we're talking about, first off, steroid injections, right? Cortisone. Cortisone, in most studies, provides temporary relief. Now, in my kind of clinical observation, about 30% of the people get good relief for 6 months or more. However, what happens is it wears off. They get the injection, they feel great, they go back to normal, they don't do anything else to help with their knee pain, their form, and they don't change anything else. And in 6 months, cortisone wears off, and then they need another injection. So they go get another injection, but this time it only lasts 3 months. And then they go get another injection, and then the third time, it doesn't do anything, or it only helps for a month. And then the doctor says, well, I can't give you another one because it's not good for you to give them that close together, right? Or they give them in series of 3, but then you can't get that series of 3 for several times later. Now, studies have actually shown that when you do corticosteroids, it actually can break down the cartilage and your ligaments faster. So it shows a negative effect long-term on the soft tissue structures of your knee. Okay, so that's why they don't just give it every time you want. They give it in a series of 3, and they say 3 is enough. You need to take a break because we don't want things to break down even faster. So you're kind of spinning your wheels if you're relying on injections. Now, the best way, if you are going to do an injection, is follow it up with a comprehensive rehabilitation program. So if you get an injection, your pain is down, now do some things to be able to improve your range of motion and to make sure you're strong and make sure your form is good. Now, surgery. We talked about this already. It's costly. It can be dangerous depending on your age, but any surgery is dangerous. You're going under anesthesia, and it's mixed outcomes. Now, I would say knee replacement is one of the better. Now, I would say hip replacement is one of the best surgeries as far as outcomes. Most people have a positive outcome. Knee replacement, I would say the majority of people have a positive outcome. However, there are still several people that don't have relief or still have problems after, right? So if there's a way that we can prevent it, or we can do things before having surgery, that's the type of people that we like to help. I would consider it as a last resort. You've tried everything. You've been to not just physical therapy, but you've been to somewhere like natural fit therapy that spends the time one-on-one, a whole hour doing manual therapy and exercises and stretching to be able to make sure we get the root cause of your problem. And then if that fails, which rarely does, then yeah, you may need surgery. But like I said before, you'll be better off after surgery by addressing all the things before. So myth number 4, stem cell treatments. I hear it on the radio quite a bit in the Austin area right now. And I think the QC Kinetics is the one that I hear on the radio all the time. They do a great job advertising. Their messaging is very strong. But when you really look at the research, it is very new and very experimental. Insurance does not cover it. It has very little evidence, and most of the published articles are case studies. So a case study is a single person or maybe a small group of people that had a positive effect, right? There's such things as placebo and people that would get better anyways, or maybe these people had an injection and then did therapy. We don't really know. It's not enough sample size to really know if these things work or not. They're very expensive, $2,000 to $4,000 per shot, and they normally recommend a series of shots. It might be something for the next generation. They might be onto something, but it is very new and very experimental. And most shiny new things are too good to be true. We use the foundations of a healthy lifestyle, healthy diet, regular exercise, the right exercise for people with knee arthritis, and they can get better. In successful cases, they still only report temporary relief, right? It's not fixing the cause of your pain, it's just fixing the source, right? Or the symptoms, not the source. And it requires ongoing injections, which is very expensive. So why do people continue to have knee pain longer than they should, right? So first off, a lot of people never start doing anything. They're just complacent. It's part of life. I get old, I get pain, I just deal with it. I'll stop playing tennis, I'll stop playing golf, I'll stop traveling. I'll just kind of give in, right? So that's one reason why. Other people give up too soon. I've tried therapy or tried to exercise. I went to the gym for a couple months and then I stopped, right? Well, this is an ongoing thing. If you're ready to make a lifestyle change, if you want to make sure you're doing things right, then you can't give up, right? If you want to live an active lifestyle where you travel the world, where you play golf, where you play tennis, then you can't give up. You have to continue to keep your body in shape so that you can be active. Not performing the right type of exercises. I'll hear people say, I walk every day. My knee should be great. Well, walking is walking. There are ways to walk with poor mechanics, and it doesn't necessarily hit all the exercises that you need. I'm getting a couple messages. Okay, those were a long time ago. All right. So a lot of people don't perform the messages or the exercises in the right way, causing actually more wear and tear on their knees. Not working with experts who specialize in working with older adults, right? I hear this all the time. I work out with my personal trainer. He does a great job, and I would never stop going to him. He just keeps, he's so great, or she's so great. And I say, well, how's your knee pain? It's terrible. Oh, how are they addressing your knee pain? Oh yeah, we do a lot of exercises to get my legs strong. Good, are they getting stronger? Yeah. Oh, how's your knee pain? It's terrible. Okay, well you're missing something, right? And it takes a different lens of expertise to work with older adults. We have a lot more things going on, right? It's just more complicated. And sadly enough, there are really good personal trainers out there, don't get me wrong, but they do not have a doctorate level education behind why they're doing what they're doing, right? There's no governing body over personal trainers. You can take a weekend course and become a personal trainer. We went to school for 7 years to become a doctor of physical therapy. So a lot of people just have a new injury, right? They're doing great, and then they have a little flare up, and it just kind of derails them, and they get discouraged, and they stop, and they give up. Lack of accountability. They don't have someone to say, hey, come on, let's go. We're doing your exercises today. So whether you have a workout party, a buddy, if you have a personal trainer, after you've worked with a physical therapist, or if you have one of our wellness programs or things that we do to help people stay accountable once their knee pain goes away. And a lot of people just wait till it's too late. If someone's knee arthritis is really, really bad, like you said, there's some people that just aren't going to come back from that. They're going to need knee replacement. And even after that, it's an uphill battle. So don't wait till it's too late. Do something that you can do about it. So one thing I wanted to talk about when we talk about doing the right type of exercise, a lot of people, and even a lot of reputable therapy clinics and chiropractic clinics, they get tunnel vision and they just look at the knee joint. Let me do exercises for the knee. Let me do massage on the knee. Let me do treatments to the knee, right? However, the knee, a lot of times is just the culprit between two other joints, right? So I'm not really in a setup that I can show you, but if you can picture this, if I do a squat, my knees are meant to bend like a hinge on a door, right? However, your knees can come in together or they can splay out to the side. When they come together, they're not bending in a straight hinge position. It's putting torque on the knee. And a lot of times that's because of your weakness for awareness in your hips. Most of the time, as Americans, we sit too much, we're not that active, we don't do a lot of side-to-side activity, our butt muscles get very weak, which then causes us to have poor mechanics during squatting or walking or exercises. The other thing is your feet. A lot of people have weak ankles and weak arches and have issues with maintaining their feet, your foundation, in the right position, which then causes extra twisting at the knee joint. And every time your knees, or every time your feet collapse in, your knees follow, right? And it takes them out of that normal hinge position and puts too much stress on the knee. So those are the things that we do differently than some of the stereotypical, let me just massage your knee, let me just give you squats, let me just make sure your quads are real strong. Yes, getting your quads strong is really important, but if you're missing really big pieces of the puzzle, then you're just gonna spin your wheels. So hopefully that helped. So what are some options of working with natural fit therapy? So I told everyone that we would talk about what it would look like to work with natural fit therapy. We have one-on-one treatments supervised by a doctor of physical therapy. This is what you would consider traditional physical therapy. However, we're one-on-one the whole time. And so you're working with your therapist. They're making sure you do the exercises right. They're doing hands-on work to make sure the range of motion is good in your knee. We're making sure all the mechanics work well, right? That's where most people end up starting. We also have one-on-one wellness and personal training. So once people get out of knee pain and their knees start feeling great, we noticed when I first started natural fit therapy, I was like, I'm gonna get everyone better, I'm gonna save the world, right? And people would come to me and they'd start getting better, 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 better. I discharge them with the best exercises that they can ever do, and slowly they start going downhill. And I would see them in my office 6 months, a year later. I said, what is missing here? And I realized people get derailed. They don't do their exercises. Life gets in the way. They start doing the exercises wrong. Sometimes they'll come in and be like, I've been doing all the exercises. Watch, let me show you. And I'm like, where did you learn that? I did not teach you that. And they're not doing things right. So a lot of people will continue with our personal training, or if they're really not that bad off and they just want to prevent knee pain, they can start at one of our personal training options. We also have a group virtual wellness membership. This is great for people to bring the cost of treatment down. We do group classes right over Zoom. We do 4 a week, one that specifically works on balance, one that specifically works on strengthening, especially for the knee joint. And then we have one that works on stretching to make sure we're mobile. And then one that's a little higher pace that's good for cardio to keep your heart healthy. So a lot of people don't start there, but I just wanted everyone to be aware of what options are available. But where most people start that are new to natural fit therapy is they start with a discovery session. And a discovery session is for someone who thinks we might be able to help, but are still nervous and skeptical, and they're not really sure what to do next. So like I said, I was going to give everyone an option to be able to get one of these free discovery visits. So we have 2 options. We have a virtual option and an in-person, okay? And this is for someone, like I said, who thinks we might be able to help. They've heard some of the strategies and techniques that we've talked about today, and they said, you know what, I'm curious. I'm not sure, but I would like to talk one-on-one about my specific situation, right? And so if you go to the link there, and Victoria will drop it in the chat here shortly. Hopefully she's still with us. And all you have to do is enter your information in there, and then it will alert us that you're interested in one of these discovery sessions, okay? Now, the cool thing is if you book today, then you will actually be eligible for a free month of our virtual group wellness membership, which is a $100 value. Okay. Now, this is something that you most likely will use in the future, but we know that a lot of people will be on the workshop today and they'll say, that's me. I need to do something about it. I'll do it tomorrow, though. And tomorrow rolls around and the dog makes a mess, or your wife asks you to do a new project around the house, or the grandkids come over for a visit, and then it's out the door and you forget about it, right? And so we want to give everyone a little bit of incentive, because we know human nature, we know how people are like, we know how to get the most out of people. And so we're going to give away a free month of that membership, just to come and do a free consultation, right? So go ahead and click that. It's naturalfittherapy.com/knee-pain-DV. That's DV for discovery visit. If you don't want to mess with that, you are welcome to go ahead and call our clinic. Our phones will be switching off in the next like 10 minutes. So just leave a message, say I want my free discovery session and I want to make sure I get my free bonus. They will call you back tomorrow and talk to you about that. So I just wanted to go ahead and tell you a quick story. I was talking to someone on the phone just a couple months ago. His name was David, and that's him with his wife there in the picture. And he twisted his knee a while back while walking his two dogs. And this was pre-COVID, right? So he was in pain for several weeks, but he just didn't want to make a big deal about it. And so he just kind of let it go. And then during coronavirus, he really didn't do anything, right? And so he sat around a lot for, he's in the high risk category as far as age. So he spent a lot of time staying at home, quarantining, being safe. And so he was a lot less active. And his world went from being able to golf and go walking with his dogs every day to really just doing nothing. And when he started to try to get more active, once the kind of restrictions were lifted, his knees were killing him. And it was actually his wife who ended up calling us and saying, can you help my husband? He's really stubborn. He doesn't want to do something about it. And so he actually came in for a discovery session. And his first things out of his mouth is, I'm not sure why I waited so long, right? So I don't want you guys to think about waiting too long, because we're here to help. So I want to go ahead and open it up to questions. So if you if you're shy and want to just kind of put a question in the chat, that's fine. If you want to just unmute yourself and holler in a question, I'd be happy to take questions. We got about 10 minutes or so that I can answer questions. If not, I have a couple stories I can tell as well. Joe, got any questions?
No, not really, but thanks for asking.
Yeah. Mario, what are you thinking?
I had knee replacement surgery almost 5 years ago, and my knee has been dogging me ever since. And the last 4 sessions with my surgeon, it was, to put it informally, well, you're a slow healer. It's going to take time. He didn't say these words, but my interpretation was just suck it up. And I've been doing that for the better part of 5 years, and my knee is still very painful. So it's not a question, it's just an observation.
Yeah. I mean, sadly enough, I'm sorry I'm sorry. You think about, sometimes I wish surgeons had a little bit more holistic view. Now, I have nothing against surgeons, because you probably needed a knee replacement when you got one. But a surgeon, their only tool that they use is surgery, right? And so they're not the experts at movement and rehabilitation. And sadly enough, I find a lot of surgeons that are very proud of their work, and they will actually tell people that they don't need to have therapy afterwards. And some people get that stuck in their head and then they don't reach out for help. And not saying that you didn't reach out for help, but 5 years go on and you still have issues. So we work with people like that all the time. I'm sure we could at least have a discussion of how we might be able to help you. So if you're at all thinking about getting some help, doing either the virtual or in-person discovery visit would be a great place to start.
Thank you.
All right, who else am I missing here? Was Sharon able to get on? Sharon, are you there? You know how to, you're on an iPad, it looks like. So if you tap your screen and then on the bottom left-hand corner, there'll be a little microphone that you should be able to click. And it looks like Bill sorted out before I could ask. Sharon,
I wanted to participate in this workshop as kind of a review of what I've been through over the past year or so. I originally came to you because I can walk up and down steps with great difficulty. And that was really slowing down a lot of activities. It improved some, and I still work not only with one of your therapists, not on knees at this point, but anyway, I also still work with my personal trainer. And originally it was an issue more of functionality than of pain, but recently the pain has been what's been a problem, plus the functionality. And so I recently went back to my orthopedic surgeon and had x-rays done, and the left knee, which seems to be the most problematic, there's basically no gap between the two bones.
Sure.
And so I finally decided to try an injection, not of steroids, but of the hydrolactic acid. It's been a little more than a week, and I'm not seeing any improvement whatsoever. And so at this point, I'm beginning to look forward toward perhaps doing the surgery after the first of the year. One thing I learned was tips was to do exercises specifically for pre-surgery on that particular joint was very helpful. And of course, I also got back into my regular trainer option. So I don't regret coming to you because you've done me a lot of good, particularly right now. A shoulder is the issue, and I feel like that's been very helpful. But I do feel like I have tried everything up to this point, and probably surgery is my only option.
Sure. Yeah, I mean, like I said, I without working with you personally, I wouldn't know like kind of when to make that call of when we've tried everything, because I know we kind of switched to shoulder and we could switch back to knee, but the principles still apply, that you're going to be better off after surgery if you continue to do the things that we've been telling you, as far as getting your hip strong and making sure that you stay nice and strong. And that's going to improve your outcomes if you end up having to have surgery. So definitely, when you do come in, make sure that your therapists know that, so that they can make sure that you're on the right path for that as well. I know the shoulder is the main focus, but there's no reason why we can't work on both. Thank you for coming on today. I didn't know it was you, Sharon. I just saw Sharon's iPad and I didn't know it was you.
Okay.
Awesome. Well, unless anyone has any other questions, we'll go ahead and bring it to a wrap. I thank you for everyone for coming today. And it was lovely talking with everyone. And if you know of anyone who thinks that this might be interesting to them, we did record it and we're working on ways to go ahead and share this and distribute it afterwards. So if you have anyone that you think would like to hear this, We probably won't be doing a knee pain workshop for several months, but we can get the recorded version to them. So go ahead and reach out to us. Mario, if you're interested in that discovery visit, just go to that website or call our clinic. Victoria, can you drop that number in the chat real quick so that if he doesn't have it, he can get it? Yeah, 512-730-0231. Awesome. I look forward to seeing everyone soon. And you guys have a great rest of your week and a great weekend. Take care.
Thank you, Ryan.